Hey guys, Dr. Jason Barker with Rocky Mountain Natural Medicine, and I wanted to talk to you really quickly about digestive symptoms. Of course, I see this a ton in the clinic, very, very common to have these problems. And different symptoms make us think different things about what's going on with your digestion. So if you're somebody who eats food and then you're immediately bloated, you feel full, you feel stuffed, you've lost your appetite, you'll feel that bloating kind of up high here in your stomach area, which is just below the, right at the bottom of your ribs there. That usually signifies a deficiency in hydrochloric acid, or HCl as we call it. And hydrochloric acid's job is to mechanically break down that food and turn it from its relatively solid state in your stomach into a liquid so that it can be further digested in your small intestines. So think immediate bloating, we've got a problem with HCl. Now then, if you've eaten food, it kind of seems like it's passed out of your stomach relatively quickly, but you're getting some bloating later on, maybe an hour or two later, lower down in your GI tract or lower in your stomach there. Then we're going to start thinking about pancreatic enzymes. So your pancreas, of course, is an organ lower down. It secretes a whole lot of different enzymes because that's when we want to start breaking down and absorbing fats and proteins and further breaking down carbohydrates. So bloating later on, lower down, maybe a problem with pancreatic sufficiency. And then if you are bloated all the time, or you've got bowel changes, constipation or loose stools, or you feel full all the time, then maybe we need to start thinking about two separate things. One, a food sensitivity. You're eating a food that your gut just does not like. Or the second thing is looking at bacterial imbalances. So of course, we've got all this bacteria in our lower GI tract. It serves a very important purpose of keeping our digestion on track, plus a lot of other cool things that we'll talk about in future videos. But if you've got an imbalance in that bacteria, your whole digestive tract is going to be upset. You're going to get a lot of more chronic digestive type symptoms. So if you are having these symptoms or somebody you know, please come in the clinic and we'll figure out what's going on with that digestive process. It's very detailed and complicated. It starts all the way from your mouth all the way out. So we need to ask a lot of detailed questions and figure out what the root cause of that stuff is. And by the way, please do not go and take an antacid drug for any GI symptoms that you're having, okay? Antacids, of course, block the acid. We need that acid to do its job to start breaking that food down. If you get on an antacid, it's very, very difficult to get off of those drugs. Oftentimes they're prescribed chronically. They're not meant to be on. You're not meant to be on them for a very long time. So the longer you're on these meds, the harder it is to get you off of them. So please don't go do that. Come in the clinic, let us know what's going on. We'll do our best to help figure out your digestive problems. All right, thanks for watching, and I'll see you guys again soon.